Thank you all for being here this afternoon. A couple weeks ago, we communicated that Clark County Public Health and PeaceHealth Southwest were investigating the potential of whether patients at PeaceHealth Southwest could have been exposed to the hepatitis C virus while in our care here. At that time, we were continuing our investigation, which we're still working through. We told you we'd follow up with you to let you know where we were about now. And so this is the update for that. Before I go any further, I realize this situation has caused some anxiety with patients and within our community, and I want to apologize for that again. We're here to take care of the health of people, of our patients and our community, and that's what's driving all of our decisions and approach to this. As of today, we still do not have evidence that any patient was exposed to the hepatitis C virus at PeaceHealth Southwest. However, with our commitment to patient safety and the health of our community, there are more steps we need to take in this investigation to make sure that everybody is well cared for and safe. I'd like to first just maybe provide a real brief summary of the facts, and then I'll tell you where we're going from here, what our next steps are. So the facts, back in August 2012, there was a patient at PeaceHealth Southwest who received care here. In December of 2012, we were notified that that patient had tested positive for the hepatitis C virus, and there were not any known risk factors for that patient to have contracted the virus. An investigation was conducted with Clark County Public Health and PeaceHealth Southwest, and no transmission source was identified. So we don't know if that patient did get hepatitis C at PeaceHealth Southwest or not. In an unrelated, seemingly unrelated incident, in February 2014, our caregivers, following our policy, reported that there was a person providing care who was acting unusually, and we needed to follow up and check if there was any substance abuse concerns there. In the course of the follow-up of that investigation, there was some evidence that there might have been drug diversion occurring with that caregiver. We don't know, again, if there actually was drug diversion. Drug diversion would be, for example, a person taking drugs that were intended for a patient for their own personal use. So we don't know if that happened or did not, but we were investigating that. In the course of that investigation, we identified that caregiver was one of those who had cared for the patient in August 2012. And so the suspicion of potentially drug diversion, coupled with the question from the patient in 2012, has led us to want to make sure that if there has been any other, if there was exposure, we want to see that. And if there might have been any other patients, we want to make sure that anybody who could have been exposed is tested and that we make sure they're okay. Again, we don't know if there was drug diversion. We don't know where the patient got hepatitis C, but each are concerns that we want to follow up on. I should also say that we did have blood samples and lab testing was done to see if we were able to establish a link between the patient from 2012 and the caregiver from 2014, and the results were inconclusive. So we don't know from lab results if there was a match or there was not, and we don't believe that that is knowable. We had that tested at CDC. So that's where we are, what we're doing about it. We are notifying approximately 936 patients, not approximately, actually, 936 patients. And those are patients who were in the care of this former employee and who were administered drugs during the course of their care. And so we want to make sure that any patients who were cared for, that we don't believe that there was exposure, but we want to make sure that that's the case. If it is determined that any patient was actually exposed, we will take responsibility and follow up and make sure that patient receives the appropriate care at our expense. I want to thank Dr. Alan Melnick and Clark County Public Health for their work. It's been a joint investigation. I think we've done a lot of work. We've dug deep and worked hard to make sure that any risks that could be identified were, and that any follow-up that needed to happen did. And so again, our commitment is to patient safety and to the health of our communities, And it's on that basis that we believe we should exercise this level of caution and make sure that anybody who might have been exposed, that we are able to check that. And that's what we're setting out to do. So thank you, Dr. Melnick. Lastly, I just want to thank our many caregivers at PeaceHealth Southwest who every day provide excellent care to our patients and who have worked very hard to make sure that all the investigation work is done exhaustively and properly. And so I'm just very proud of the work that they've done. Thank you.
So I just want to give you, go along with what's already been said, what Cy just said, and give you an update of where we are from our perspective from when we last met 2 weeks ago. And I want to reiterate what I said last time, was that we still believe the risk is really low. As I mentioned last time, we've been combing through hepatitis C reports in Clark County, and since since August of 2012, we haven't found any other cases that have been reported that we could tie to exposure at PeaceHealth Southwest. So I want that to be really clear, that there's no evidence of some sort of outbreak, or it still seems like a very low risk situation. So I know people are concerned. I want to get that information out first. The other point I want to make is that last time we were here, we told you that we would be actually looking, as part of our investigation, we'd be looking through voluminous documents and records to identify people who might have been exposed. And also we wanted to make sure that we didn't notify unnecessarily and make people worried who weren't potentially exposed. So that's how we came up with the 936 number. We've actually identified 936 people we think could have been exposed, could have been at risk, because they were in a location where they received care from this former employee, and the care included medications, scheduled substances that could be used for diversion. Any location where that former employee may have been able to get access to medications that would later might be received by a patient. So we went through that list pretty extensively, made sure there weren't duplicates, and that's how we determined the 936. The other point I want to make is that we are going to do whatever we can to make sure that every one of those 936 people gets notified. We've already spent time verifying the addresses, that they're real addresses, with the U.S. the Postal Service, U.S. Postal Service. I believe out of the 936, there may have been 7 addresses that were questionable. We actually can look at property records and other data sets to make sure we reach everyone. If somehow, in spite of all this, mail bounces back to us, we are prepared to call anybody if necessary and track people down. The other point I want to make, making several points I guess, is that not everybody who's on that list of 936 lives in Clark County. Some of them live in other counties, and some of them live in other states. We are still notifying them, and we are also working with the state and local health departments wherever these people live to make sure they get notified. We want every one of those 936 people to have the opportunity to get tested. So we're going to dog that due diligence to make sure that everybody gets notified. So that's where we are right now. Obviously it's going to take some time to get test results back. We're working really closely with the CDC. If we get test results that show people have infection and we have virus to study, we will actually be working with the CDC lab to do genetic testing on the samples to determine whether there's any connection, potential connection, whether any of those folks have infection in common that could tie this back to being a patient at PeaceHealth Southwest. So that's where we're at. We obviously don't have any results for you yet, and we just wanted to have this press conference just to let you know where we are and give you an idea of the numbers that we're talking about. So that's all I have to mention at this moment.
Thank you. Now would be a good time for you to ask your questions. I've been asked to repeat the questions so that they're easier to pick up on the microphone.
Can you describe just in layman's terms what diverting drugs, I mean, what of the suspected former employee, Was it pain medications, they do some and give it to somebody else? Can you kind of
Let
describe?
me give you an example how, again, we don't have any evidence that this occurred, but let me just give you an example of, I'll give you one example of how it could occur. Somebody takes a syringe with a scheduled substance in it, let's say something like hydromorphone, out of the supplies, and goes ahead and gives themselves an injection with part of the dose, then removes the needle from their arm, and then gives the rest of the dose to a patient. That's one way that that could possibly happen. So they're diverting some of the drug, that's what diversion means. They divert some of the drug to themselves, and then maybe give the rest of it to the patient, and you can see how contamination can occur. That's just one example. There's several different ways that it can happen, but that's a possibility.
How long have you guys been working to make contact with these 936 people?
So we just sent out the notice. So it's taken a while. One of the reasons that we were told we'd be sending out the notices today is we really went through, all you can imagine, we're talking about 2 years worth of data, and we went through all the records to identify where every one of those patients had been, who'd been in a location, and were receiving the kind of medication that could put them at potential risk. So we just sent out the notifications yesterday, and there's going to be more. I think a few more going out this week. But so they're just getting notified now. We wanted to notify them first before we had a press conference, so people could get the message potentially first before it gets on the news. We also sent out a message to the healthcare providers, because we figured in the region, because we figured that healthcare providers are going to get a lot of calls once this gets out, and we wanted to alert them as to what they should look for. So that's why we're here today. I hope that answers your question.
Where's the accountability for this former employee?
I'm not sure what you mean by where's the accountability.
Is that person being held accountable? What's happening with that?
So let me repeat what I've said before. We do not have any evidence at this point that this employee actually infected or exposed somebody else. So that's part of the investigation that's ongoing. If that were to be determined, down the line, I would imagine there should be some accountability, but we haven't determined that yet. So we're still investigating that piece. We're notifying all these people because we're concerned we have enough of a suspicion right now. We think those 936 people have a right to get tested, and should be. We have an obligation to do that. We have no evidence yet to for example, to prosecute anybody, for example.
What evidence do you need? What would take it from this employee being suspected of doing this to actually proving that they did?
So I can only give you hypotheticals about this, and I really don't want to do that because without any information or any data that this person actually infected or caused anybody to be exposed, they still have a right to privacy, and I do not want to give out information on this particular former employee. We're not quite there yet. If we were to get to a point where we were able to determine that, we'd be having a different conversation, but we're not there yet, and they have a right to privacy.
I would like to add, though, that in the course of our investigation to date, and I expect continuing, we have informed any authorities that should be, according to the facts that we have access to, and so we are including any other authorities that should be involved based on the facts.
So the Vancouver Police Department, are they involved now, or are you guys still working?
So the Vancouver Police Department is aware of this, but at this point, you'd have to ask the Vancouver Police Department, but there is, like I've said over and over again, we don't have any evidence that this employee did anything that exposed people. So, you can talk to the Vancouver Police Department, but right now we're not at the point where we have information that says something criminal was done. We're not even close to that at this point.
Do you have evidence that the employee did use drugs illegally, did drugs for his personal use?
Go ahead.
No.
So not even evidence?
We have suspicion.
Suspicion.
We don't have conclusive evidence.
Can you describe that suspicion to any degree? Like what exactly that means, suspicion?
So basically, the hospital has a pretty good setup in terms of when you take medications out of controlled substances, you have to use a fingerprint, and you have to account for the medication. There's some information, and it's complicated and detailed, but there's some information that says not all the medication, there might have been some wasting of the medication, and not all of it may have gotten to the patients. We don't have conclusive evidence for that yet.